Good afternoon and welcome to Webinar Wednesday. Today we are joined by Mike Roggmann, Project Manager Implementation Lead at Phoenix Data Systems. Webinar Wednesday would like to thank our sponsor, Phoenix Data Systems. Phoenix is committed to offering the finest CMMS software, service and support available in their industry. Their AIMS-3 software is powerful yet flexible to improve operational efficiency and has evolved by listening to and collaborating with their customers. Their annual AIMS user conference is one of the primary ways they achieve this exchange of ideas. Phoenix is dedicated to the continued development of their AIMS-3 platform. For more information, please visit goaims.com. Just a quick reminder that MD Expo is headed to Temecula Valley's Pechanga Casino and Resort next month, October the 11th to the 13th. Registration is open online at mdexposhow.com and you can use VIP code 22MDESOCAL at checkout to receive complimentary admission to this 3-day conference. The VIP code is available to individuals employed with a hospital, healthcare facility, or an active military or students. Proof of employment is required. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar, and you must complete the survey to receive your 1 CE credit from the ACI. You'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. Phoenix Data is headquartered in Michigan. What is the University of Michigan's football team known as? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Mike Roggmann, Project Manager at Phoenix Data Systems, is our presenter today, and he will discuss using existing tools to strengthen your workflows and compliance. Mike, you may begin whenever you're ready.
Thank you very much, Linda, and welcome everyone. Just to give a little bit about myself, if you will, I've been in healthcare for almost 25 years as far as different things. Originally, my education is a clinical engineer and biomed technician, if you will. Spent some time doing that and then moved up in the hospital system, and we ran a 4-hospital shop, biomed clinical engineering shop, in southeastern Virginia. Then moved over to the CMMS world because I was recruited by one of those software platforms to help in implementations and project management. And then did that for, I don't know, 11, 12 years, and then went to healthcare IT, helping the healthcare system with their CMMS systems, as well as their facility management system, so building operations and those types of things. And back in the CMMS world, I'm glad to be here with Phoenix and working with them to implement software and help you guys get these things moved forward. So kind of some different things we'll go through today as far as the agenda. These are the kind of things that are near and dear to my heart. In fact, these reason we work through this topic is been through several Joint Commission and DNV surveys, and had the questions and the answers and the pushback on different things. And so workflow is very important, not only for efficiency but also for that compliance side of things that we're kind of the crux of what we do every day in the healthcare industry. So so what is a workflow? We'll talk about that and kind of where again, we'll keep those kind of high level as far as what the workflows are, because I'm not going to bore you too much with that. Again, what the different questions are, what why do we do it? And more importantly, we'll spend probably the most time talking about what it means and how you can better your CMMS processes, workflows, etc. With workflows, and really how it can help with your efficiencies and even technician retention, as far as making them happier using the software, getting them in and out as quickly as possible, makes your reports better. The list is very, very, very long. So we'll talk a little bit about those. I don't like reading PowerPoint, so I figured you guys didn't see it enough. And then we'll also talk about probably the biggest thing here is how do you continue doing that? It's not something that should be done once and forgotten about. It's really something that you should do as regularly as you do a PM on some things to refine your system. And also you can pick different areas to do different things. So we'll talk through all of those pieces. So what is a workflow? Real high level, it's basically how you're doing something and why you're doing it. What part of the process does it solve? What part of the item or function does it solve? Parts of those workflow items can be policies, procedures, directions, how-tos. You know, if you really want to see a few workflows, go on YouTube and type in how-to and see how many you get. There are going to be everything from changing a tire to probably building a space shuttle is on there. But certainly these are a big part of what we do and why we do things in healthcare. And it is a big piece of the puzzle and hits the next one as far as why it's important. Can't say this one enough. It is the reason we do what we do, and that's patient safety. Medical equipment especially, but even the facilities equipment, so HVAC, et cetera, has really come into play with the pandemic that has been hitting us for the last several years. So patient safety, number one, is really the reason why this is important. And then, of course, the regulatory bodies can make sure you do what you are supposed to be doing is really what it boils down to. Then the third bullet point I think is interesting because it makes repeatability is important. If you think, the best analogy I've ever found for it is it's repeatable. It's an assembly. You can make it as repeatable as an assembly line. That way, there's less mistakes, there's less issues, and there's less wasted time for all of you guys making yourselves more efficient. Really, that becomes important because you know, when you get down to it, it is looking at the black and white for the those financial people out there that want to make sure, you know, everything's being done as economically as possible, while still getting a good outcome. A good. This is kind of the thing that I've always done when I was a clinical engineer and it was given to me by a Joint Commission surveyor way back when. It really boils down to one thing: do what you say and say what you do. And workflow management is part of that. It's because it does involve your processes, your procedures, your definitions on why you do things, medical equipment management plans. Those types of things are important. We all have them. We should have them anyway. But what do you do to refine them besides looking at them once a year because it's part of the process of your organization? You go in and make those edits and do some adjustments to them. So where to start with it? Kind of everybody's got the hardest part is getting that point to start. Where do you go through? And I think almost should have put these bullet points in a little different order. The third bullet point there, and I'll start there, is if you've hired a new person tomorrow, would you be able to give them your processes and your documented processes and procedures, and would they be able to get a very good idea of how to do their job and why to pick certain things, especially within your CMMS. Results or responses or different things at your classifications of equipment, those types of things. Could you hand them something and they do it? I know when I first started doing this, the answer to that question was no. There was no way that was done. And it did is something we put together and even strengthened throughout the couple years we were doing those things. That isn't fun. But now and teach people how to do those things. So going to the other bullet points, does it match your configuration? Again, going back to those workflows, those procedures, and those processes, do they match what you have? So again, you had a new hire, do they know when to pick certain things for statuses? Do they know how to the process for retiring a piece of equipment? Those types of processes that can set off, or more importantly, a recall. So those are kind of important pieces, not only for the a new hire, but also for your existing, to make sure everything's being done as you guys have documented. And also, when's the last time you touched it? When's the last time you updated it? Processes change, workflows change. It is one of those three constants in life, if you will, is change. So you should take a look at them every now and then, or if you make an adjustment, or as part of one of the things that I do as far as project manager implementations, we change CMMSs. So we went from an old CMMS to a new CMMS. Once you do that movement, are your workflows involved? Because changing a CMMS will change your workflows. There's no question about it. They always do, to some degree. So what does that mean within a CMMS? I just got a couple of them in here. Unfortunately, this is one of those topics that I could probably talk on and on and on about. But I really only boiled it down to two. The two big ones in any CMMS, and that's one, your workflows or your work orders, excuse me. And work orders I kind of picked first because they really are the thing that gets edited the most or adjusted the most within any CMMS. So one of the things I've found during the implementations and the management of this is, well, we don't use this anymore. This is stuff we don't have anymore. And the question I have is, well, why and how often do you think you've used it? And that boils down to the different classifications of your work. So the types of your work orders, several different ways that we've seen that managed. I know I was working with a client that had over, I think it was 15,000 different classifications of work orders. We worked with them to kind of narrow those things down and found out they really only needed 20. Because they boiled it down, there were a lot of duplicates. There were things that they had no idea what they mean. So, and that last statement is a very important piece. What do they mean? What do they stand for? Is there a reason that they are there? And that's where we kind of want to make sure you have some documented definitions for those items, whether those be the classifications, the response or result of the work that was done. And then a very important piece in my mind as far as a work order status. When do you select certain things for these things? Another one is priority. What classifies urgent, stat, those types of things, whatever your urgencies are, your priorities are. And then failure types. The other reason that these can become very, very important, if we go back to one of the slides I talked about earlier, is this is where your reports are built. This is where your reporting back to your regulatory bodies are built So accuracy is important when those things are selected. So they do, as we talked about with tying it back to that workflow, if I have them defined, I can make sure my workflow is as easy as possible for the technicians to implement those things and select the right things, make sure reports better. And we've done a couple, I think it was a couple webinars ago, we've done even on your data, makes your data cleaner. So work orders, again, these are just some examples. They can certainly broaden that out as needed. There are lots and lots of different classifications you can do. The other one that I talk about a lot is the equipment side of things. Again, this can go get a long list, if you will. The documented definitions, same type of concept here, as far as the statuses of those, recall, priorities, ownership. Recently has become more a condition of those assets. Again, the financial system, we need to tie into what their definitions are. Can we use that to simplify our life? And again, how this, excuse me, these documented definitions and the definitions really go back to making sure things are efficient for selections for your technicians, making sure you're having those documented items for regulatory and your reporting. And another side of that equipment workflow, and I think these three are really important there, are your recalls. Do you have a documented recall process? And have you put in your CMMS definitions into that process so they can have and document those things properly? And usually these things, and when I first started doing this, I kept them. I used the KISS method, keep it as simple as possible, and make sure that your recall, your documentation, kind of just lays out the basic steps. So what, again, looking at it from a new person, could they follow it very easily? Same thing with, I think the incoming equipment process is another one that we get questions on quite a bit. How do you adjust these things? Again, these two, especially the recalls and the incoming equipment process, not only involve your department, but also involve other departments within the organization, such as for incoming equipment, from the purchasing to the loading dock to you, to the department that actually gets the software or gets the hardware itself. How does that flow through? Again, some of that's out of your control, but the workflows you really want to make sure is your section is as documented and tightened down as possible. And these are just a couple of the things that we can also assist with as well, because we've got a few years of industry work experience in Phoenix. Equipment retirement, that one's a little more straightforward, but that brings into the HIPAA processes. Have you tightened up that selection for the disposable medical equipment based on whether they contain or can contain or transmit, all those other fun HIPAA definitions? Do you have it in your plan? Do you have the workflow documented for that? Plus, again, these are usually pretty simple. You guys do them all the time. It's really just about making sure they align your documentation and your CMMS align. Again, I could probably go on for a couple hours on these couple topics, but I won't. You guys would hang up on me. So, because there are quite a few of these, but as I mentioned in the kind of last line here, just pick one. If you don't have a lot of these documented, or some people don't have any of them documented, I've run into, pick one. Pick one item to start off with, and go through that process of writing down or typing out the bullet points or your number of workflows. You'd be amazed at how quickly you can get this done and how easy it can actually flow. Because again, you guys do all of this all the time, and you're probably following the same basic process. Other thing that I've found that during these processes is once you document them, you'll find out that different things that you do may be a duplicate. So you will have a little bit of waste involved or wasted time involved in something. So is there a way to speed that up, to change one little thing and make your process more efficient? So how can AIMS-3 help? A couple different ways. So one of those is we have an automation tool within AIMS-3 that'll help you with some of these workflows and automating these. Again, going back to that documentation and making sure this is part of your process. One of those may be if you go in and if you retire a piece of equipment, what happens next? Does it go through and do you want it to close all the open work orders? What's your process for that? The automation within AIMS-3 can actually help with those types of things. Same thing with the unable to locates. This happens a lot. I was talking to a client the other week. Well, their process was they flagged the work order and it was a work order status. And they did have this documented. It was great. That when if they had two unable to locate work orders, they went in and changed the status of the equipment and could help with the automation on that as well. Again, it's just what you guys want to do, what your process is, and the application can certainly help. Incoming equipment, or excuse me, equipment retired. What do you do with those work orders? What happens next? Is there any notification that needs to go out or any reports that need to go out? Those types of things can be automated. You can do some of those steps or kind of reduce your number of steps that you have to physically or manually take by setting up these different things. Two, before I get to the et cetera, if you will, actually are probably some of the most common that are set up for these automation sections. Incoming equipment, what happens? You put a new piece of equipment in, create a new equipment record. Most people's processes is you need to generate an incoming inspection work order. You can certainly do that, and automation can help you do that. Again, taking some of those manual steps out, so tightens up your workflows, increases the time that you're actually working in the system, so you guys have more wrench time, able to get back to the clinicians quicker and get equipment back. And what is your failed PM process? What's your failed PM workflow? So is it a task that needs to go through, or is it a work order status, or all of these things can be set up with an automation so you can, again, keep your workflows a little simpler and still have great documentation moving forward. And we've kind of just brushed the top of what the automation systems can do. There are quite a few more, and we're actually developing more as we move forward and listening to the clients of what they actually need. So, and that's just automation. There are quite a few others within AIMS-3 that can help. So how are there different ways to review workflows? How do you do it? Once you've got it set up, you need to monitor it. Some of the basic systems that can be done, of course, you guys probably guessed this one, reports. There's a wonderful export feature within AIMS-3. I know a few other CMMS that have export features as well. But the one in AIMS-3 works very, very well and can even be to go back to the previous slide, automated. And even doing some comparative analysis. So just real quick, looking at what you did last year versus this year. And that can be done either with reports, exports, or if you get a little more in depth in some dashboards. So now you got to keep looking at it. So continuation of that monitoring setup. We have a feature, as I was hinted at earlier about the automation of exports or reports called morning news. You could set up different things for what they call morning news. No, it doesn't have to just come in the morning. You could pretty much set them anytime you want and how frequently you want. And it's a great way to, set it and forget it, if you will. So it will it emails you that information in many different ways to give you those Excels or the reports or however you would like to continue monitoring that. So if you set up the report, once every 6 months, once a year, to give you the kind of spot check, you certainly could. The spot check section, sorry, I was reading that when I was looking at the other. It's a great way to look at if you have any anomalies on those reports that are automated. Just kind of look at it. If something doesn't look right, it probably isn't, and just give it a quick look. And this is that item that helps you with that workflow and to tighten that workflow. If you've got somebody that's really not sure, maybe they're hesitant to talk to you about something they're not sure about, this can help have that conversation so you can, again, tighten up that workflow, make sure you're meeting all those regulatory guidelines and needs that you have. Once you've got that set up and automated for one process, or even cover multiple processes and workflows, what else do you want? What else can you do with it? Expand it. Make sure it evolves. Make sure it's continually evolving. One of the things I've learned in the industry is our industry does not stop changing. That's a really good thing. Because we are constantly going to be in need of technicians and managers, and our place in the healthcare world, if you will, is there and very cemented. But we have to continue to evolve. We have to continue to move through those things. So how do our processes evolve with them? How do our workflows evolve with them? If you see, going back to what we talked about earlier as far as the work orders, go back all that far. If you see a need for something, an additional work order type, keeping it simple there, define it, follow the process through. Can I automate any of it? And do we need to continue to use that or review that item? So this one's the last one's as far as that education. You guys are doing it right now. Continue the education. What is the industry doing? And it's great that we have AB and ASHI and others, even though your state organizations that are involved. I've been to several different state classes and state shows and exhibits, and you really learn a lot by interfacing with your peers and finding out what they're doing and see, is there a better way to do something? Is there a better way to do that work order process that you're talking about? Even if it's just a procedure, or you're going into the realm of the AEM, alternate equipment management processes. So very important piece of the puzzle there. And then the next item here, this is something, again, I set mine up as an annual process when I was working in the hospital itself. I think it's a good thing annually. You usually have to review or kind of do your processes annually anyway for those regulatory bodies, just add the extra step. Look at your workflows. Did you guys add a code that you didn't think of that needs to be added, or add a type that needs to be added to your processes and your procedures? It really doesn't take a ton of time once you got them set up to just look at it and make sure they're where you need to be. Or better yet, do you need to remove some and make things a little simpler? Because nobody likes to scroll through really long drop downs. So one of the things we get asked is, how can Phoenix help with these things? Typically, this is done, we get asked this question pretty much during the entire process of interfacing with clients. So there's a couple different ways we can do this. We do hold during your implementation. So you started a project with Phoenix to implement AIMS 3. We do hold workflow meetings. And in fact, we talk about how you do things, or how you implement certain things based on what you as the client would need. So if you think your workflows are pretty good, we're going to look at the data one way or the other and kind of harvest that and show you what it is. One of the things that the data team does here is pull out those different codes we were showing you earlier, the work order types and priorities, those types of things, and give you counts and say, here's what you're using. Good, bad, or indifferent, this is what your data says. And a lot of organizations will take those types of things and say, yeah, we need to do something about that. We need to merge, we need to adjust, we need to tighten those lists down. What are you doing when you do that? You're adjusting your workflows. You're tightening up the workflows. You're making it simpler for the technicians to edit and adjust and do their work. Very important piece. And then, of course, kind of rolling into the training part of that, work with you to, tighten those things up. But then as part of the implementation, we can help train your technicians on those processes. One of the things during our implementation that we do in the training side, first thing we do is go through, okay, let's set up the application so it meets the workflows you guys are doing, work set with the admin team for the application to do that. Then we take that knowledge and roll it into the training of the technicians. That's happening, I know, with one of my implementations this week, actually. So it's an important piece to look at, and an important piece to think about, not only during your implementations, but after. Are you maintaining what was trained and what you guys decided upon? It's kind of rolled into the AIMS 3 setup in that discussion as well. A very important piece. And after the fact, can we help you guys after the fact? Well, that's what your support helps pay for, if you will, your annual support. If you have questions, we're always happy to ask them or answer them, and work with you to get the best you can and best workflows out of your system as possible. Whether that being with automation setup, maybe we'll also do a little more training with that, etc. One of the other items we have here is the Superior Analytics, and it's kind of a grouping within the Phoenix umbrella, if you will. And a couple things they do, and that group does, really look at the kind of costing of your system, data cleaning, normalization of that. There's great ways to do this, and there's a lot of people a lot of hospitals and healthcare systems that can benefit from this type of thing to make your data more accurate. Your equipment normalization, etc. So only had this, just wanted to briefly mention this piece of it. If you want more information, you can certainly give us a contact. So this is a question that one of the reasons I actually, one of the things that drew me to work with Phoenix and on the implementation side is, do we practice what we teach? Answer to the question is yes. We actually do all of these things I'm talking to you about internally, not the work order classifications and that kind of stuff, because we have a few of those. But do we listen and learn and continue to evolve on our workflows? Absolutely. One of the things we do is work with the client at the end to do a load of lessons learned, continue that process. So what does the client think that went good, bad, or indifferent? Then we get the implementation team together along with the manager and kind of go the same way, grade ourselves, if you will. Did the client give us a B? If so, why? What can we do to improve that and make not only implementation better, help our clients' workflows, be a better steward of their time as well. So it is certainly something we always want to have the client's feedback on. It's important to us. As I mentioned, it's one of the many reasons I went and joined Phoenix is listening. So a couple different things, kind of rounding these things out. Clean and documented workflows. It's not, you guys do these things every day. And are you are they documented? Or do you have the reasons you're doing these things set up so you can easily teach someone else? Because there's a big job. It's an important thing that we do in maintaining the equipment and the environment for the patients. I think now more than ever it has come into focus. So just kind of appreciate those times, and we'll just kind of roll into the questions, I think, if we have any. Linda?
Yes, we have. Sorry, Mike, about that. Yes, the first question is there a method for helping let techs know about contracts and other work related to a device?
Yeah, there's a couple different ways that can be done. Let me just pull up these here. I think. Let's see. There we go. So a couple different things that can be done. It really depends on where the technician is and what their configurations are. So one of the quick ways to do that is to look at the equipment records, and we use what we call the custom critical messages at the top of a piece of equipment, and it shows all types of different things. And again, these are based on the workflows. Let me find this piece here. Yes. Actually, this one's a pretty good one. The equipment's under contract. You can actually click on the link and go directly to the contract there. It's a high-risk piece of equipment, patient safety equipment. Kind of a nice to have on those, another blurb, if you will. And more importantly, this piece of equipment also seems to be down. So why is it down? Again, clicking on this will allow you to take a look at the work order associated with that. So there's lots of different ways to address those things. So if I click on the equipment down, I can certainly see the work orders associated with this piece of equipment. And if I need to, click into those as well, so I can get additional information. From there, you can review what's needed to be done. Another type of thing that you're looking at, if you notice, when I went to the work order, you also got, this is a billable item. So for those who do any billing within your organization, you can flag that as well. But the question is about contracts, so we'll look at the contract. You can see that information as well. What does it include? Again, this is important for putting the different labels for your travel, your parts. You're putting those, excuse me, equipment and work orders, excuse me, the labor entries and parts in for that. So going into that piece of that, the labor entry for that, what was done. One of the things I'll kind of bring it back around here. I'll edit this one. Those responses, kind of those workflows. When do I use which thing? Most of these are pretty self-explanatory, but we talked a little bit about the HIPAA remediation as well. So that's one of the ways you can look at contracts. And sorry I deviated just a little bit on that, but it is, I think it's important looking at the workflows. We talked a little bit about it. Wanted to at least kind of put some visuals with that process. So again, I could spend a lot of time talking about this, but I won't. Anything else out there?
Yeah. How can a manager get a snapshot of PM completion and productivity?
I'm just going to log out here and I'll log in as a manager. Stuff out of the way. I found the easiest way is to set up your dashboard or homepage, as a lot of people call it as well. Again, ties back into those workflow items in that you gotta have things labeled properly and set up properly to really get your PM percentage. Shows your number of work orders. These are all different widgets that it can be on the homepage. So non-PMs by priority. So what are your correctives? Everything's sitting in your routine. That never happens. The other one, of course, is your PM completion percentage. Really kind of gives you a good line on where things are. So, open versus closed for each of the technicians that report to you as the manager. I actually like this feature in AIMS 3. The nice little dotted line kind of gives you where you're sitting for the month. Where should you be sitting for the month? We're about halfway through the month, so we're almost at 50% is where we should be. So if the technicians are below this line, maybe they need help, maybe there's a reason. Maybe the guy was on vacation for 2 weeks and we need to reassign some of his PMs. Whatever the case may be, can allow you to take some action on those. While we're here, kind of some other workflow items I'll just briefly mention. And I didn't get into them in the presentation, but purchasing of parts is another great area for your workflows, especially if you're tying in with your purchasing system or you have a purchasing department. Tying those things in to try to automate and define those workflows. I'll tell you, I've seen the setup of your workflows for purchasing really save some dollars and cents for the healthcare system. So really important for you there. As I mentioned, that those different items here, and there's again some different things here. We could even go down and look at the productivity as related to those PMs. So how does this look for you guys? Every one of these things can help you manage your workflows. But also, you notice in every single one of them, you have a different type or classification, work orders, equipment, etc. So different things there. Sorry, Linda, I get talking too much.
No problem. Another question that's come in is, can I manage software versions of my equipment?
Sure. Lots of different ways to do that. I found the simplest is setting it up per the model of your equipment. You can have certain models and software versions associated with different models, and you can manage those all either on the equipment record itself via this drop down here for different software versions. Again, I got some dummy data in here, but also your other IT and IS fields that are becoming more and more important for connected equipment. And that's not just medical equipment, but HVAC systems, all of that stuff all connects to the network. And your IT guys may just have your IP and MAC address. And they'll want to know your software version and is your manufacturer up to certain compliance that they need it to be connected to the network. So very important piece and very important question. So that can be managed, like I said, here, your software version here, and it actually relates to my data manager here, my model record. You can even set it up here as far as your software versions that are acceptable for that model. Little snapshot on the HIPAA there too. So, all right, hope that was helpful. Do we have anything else, Ms. Linda?
Yes, we do. I've got a question here. Does AIMS 3 have a mobile interface for mobile phones or tablets?
We currently have, well, it's browser agnostic, which means I can use it on any browser that's connected to the internet. I've used it on my smartphone. I've got an Apple smartphone, so my iPhone, iPads. As long as you're connected to the network or a network or the internet, it can be accessible there. I found that to be the best method to meet 90% or 95% of the needs that are out there, because you guys do want kind of all the information you can get on your device when you're connected, and this just accesses the website I'm on right now. So yes.
Okay, another question here is, will barcodes for equipment tags be available in AIMS 3?
Yes, the question would be printing or reading. Printing, I'm not sure it's doing that yet. Reading, if you've got the device and you put the cursor in the field, it's just a way of reading that barcode. It could certainly populate that into those fields. As far as some higher end functions, we are actually working on that in the near future to get a little more like QR tag type thing set up and work through that. So.
Okay, another one here is AIMS 3 officially available for US upgrade, sorry?
US upgrade. I'm implementing AIMS 3. I've got several projects implementing AIMS 3 in the US, so absolutely.
Okay, another question here is quite a long one. How would a CMMS like AIMS 3 be used for retirement and disposal of equipment, coupled with a third-party equipment SW program used in conjunction with a supply support team?
That is a long question. There's a couple different ways that can be done. One of those, of course, we talked about the automation piece of this. As far as setting up your retired equipment, I just opened up automation so you guys can at least get a visual of it. Retire equipment, what actually happens, updating work orders and all the other fun stuff. So you have that portion as well, but you're talking about sending it over to a different software company or a different application, if you will. A couple different ways you can do that. One of those would be, I think one of the simplest would be utilizing our morning news functionality and creating or having an export set up for a set of equipment for retired equipment, and maybe however often you want it. You can export it as an Excel or a CSV file, export it to that location, that other software, if you will, and that software could grab it and consume it and do whatever that workflow suggests to it. That'd be a great way to do that, actually. And the morning news can do lots of different things, and that's just kind of one of them. Good question. Whew, that made me think a little.
Okay, we've got time for one more question, and it says, does AIMS3 use the AMI recommended work order and failure codes as a default?
The answer to that is yes, it can. The most common thing that happens, though, I haven't implemented something from scratch as far as a customer doesn't have anything. We typically will bring in the types that the customer currently has as far as implementation side of things. And then we could, of course, implement those as part of that, or those types as part of that. So map them up, merge the codes so they go, if you have different classifications for correctives, if you will, narrow those down to use those AMI standards, and we can work with you to define that process. Absolutely.
Okie dokie. Well, time is coming to an end. So thank you, Mike, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So visit goaims.com. As promised, the answer to today's trivia question is the Michigan Wolverines. So congratulations to our winner, Todd Forsch. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed to you 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. So thank you once again, Mike, and thank you everybody for your time this afternoon. Enjoy the rest of your day, and we'll see you next week.
Thank you, everyone.